All right, so let's go ahead and talk about stress really quickly. There we go. Okay, so when we are talking about stress, at least as it relates to how it's conceptualized in the textbook, we are going to talk about stressors and strains. Stressors refer to disruptive events, situations, or individuals, the things that produce stress, which we'll talk about as well in a little bit. Strains, on the other hand, are the outcomes of stressors or stress. So, the undesirable personal outcomes, the burnout, the loss of engagement, those things are what we refer to as strains, just the outcome of stress or stressors. Now, stress itself, there are just so many different perspectives on how to understand what stress is. Some researchers refer to it as a disequilibrium, so this internal feeling of being not at ease. Some people have called it the disequilibrium itself, so the thing or the sorry. Some people call it the disequilibrium itself, which is what I just referred to. Some people also call it the forces that cause the disequilibrium. So related to the previous slide, they refer to the what we would consider stressors to be stress, which doesn't make sense in terms of how we think about stress now and commonly how we think about stress. I've heard other people define it. This is from another textbook in a related field of organizational behavior, where it's called a dynamic condition in which an individual is confronted with an opportunity, demands, or resource related to what the individual desires and for which the outcome is perceived to be both uncertain and important. It can also be defined as an adaptive response to a stimulus that places excessive psychological or physical demands on a person. The common themes across our understanding of stress, though, are these: that there is a stimulus, stressor, something that is placing a demand on a person that is excessive. And the demands need to be seen as excessive in order for the person to experience stress. So, if something happens to you where you have the ability to deal with it, that's not, from this perspective at least, a stressful situation, right? If your boss comes in and says, "Hey, can you hand that report to me?" and you have the report ready, not a stressful situation. It is stressful if, however, your boss says to you, "Hey, do you have that report, or can you get that report ready for me?" and you haven't even started it. So you need excessive demands in order for the stressor to be perceived as a stressor and therefore stress to be experienced. We'll talk about what kinds of demands people can experience in the workplace in a little bit, because this relates to a model of stress known as the demands control model. The demands control model argues, like I just said, that you have certain demands within the workplace. These include your workload or the intellectual requirements of a job, and then you have control, your autonomy, the discretion that you have for using different skills. And stress is experienced when your demands exceed the amount of control that you have in order to respond to them. Because of this, certain jobs are more likely to produce stress than others. Those that have high levels of demand but offer little control or ability to respond to those demands, to respond to those stressors. So, what kinds of jobs offer high demand and high control and therefore might actually lead to some level of thriving? Well, these are jobs we call active jobs, and they include things like being a lawyer, an engineer, a physician. Lots of high levels of demands, right? Being a doctor isn't easy, but doctors also have, to a relative extent, a lot of control over doing their work. So in that way, those jobs can be active and it can lead to a lot of positive outcomes like more satisfaction and reduced depression. On the other hand, we can have high demand, low control jobs like those right here. These are called high strain jobs. These include things like being a nurse's aide, an assembly line worker, or a wait person, or someone who works in a service industry. You have a lot of really high demands, but very little control about how you're going to respond to them. Remember, we just talked in the previous video about emotional labor and how people who work in service industries, it spelled out what you do when you have a difficult customer or a difficult situation. You don't have a lot of leeway in how you respond. Those jobs can lead to a lot of increased risk of illness because of the stress that people experience working in them. Now we have jobs that have high control and low demand. These are low strain. These are things like an architect or a dentist. Not, a lot of control and autonomy, but not a lot of actual demands. Um, Dentists are just a different type of physician, and I doubt they get a lot of very high stakes emergency situations, though you still can die from not taking care of your teeth. So brush your teeth, see your dentist. But then we also have passive jobs. So you may think, oh, well, a low control, low demand job might not be that bad. But research actually shows that passive jobs are also associated with high levels of dissatisfaction and depression. Passive jobs, of course, being things like being a janitor or a night watchman. Not a lot of demand, but also not a lot of control over what you do when you have to do things. So those jobs also aren't very good for people. Related to the demands control perspective, we also have the demands resources perspective. Once again, demands here are very similar. We think of them as the requirements of the job. This includes things like deadlines, pressures, and uncertainty in your work. We have resources, on the other hand, that help us deal with these demands. So control, as we talked about in the previous model, is effectively a kind of resource. The ability to do your job as you see fit is a psychological resource that we have. Autonomy is a psychological resource. Independence is a psychological resource. But the demands resources model expands it beyond that and notes that there are many different resources that we have to deal with the requirements of our work. So these are the physical, psychological, social, or organizational aspects of the job that are either functional in achieving work goals, reduce job demands and associated physiological and psychological costs, and stimulate growth, learning, and development. So here's a more comprehensive list of demands from this perspective. This includes things like task demands, so the demands of the job, emotional labor, which is in bold here. We've talked about already. It's something that's discussed in your textbook as well, so I won't go over. It was discussed in the previous video, so that's why I will not go over it here again. Physical demands can also place a stressor on people, things like the strain of the tasks that you have to do. So it is more stressful to be an Amazon delivery person than it is to work a cash register. Though that's not to say that working a cash register isn't hard. You're standing on your feet for hours at a time, and you have to press the buttons and everything. And but lifting heavy boxes and carrying them into homes, dealing with potentially dogs and animals that are aggressive, that can be more straining than other jobs. We also have role demands. Roles was brought up in your textbook, so I have it bolded here. I should have noted. I've bolded the things that I will talk about of the demands because they are either discussed in your textbook or I think they're worth discussing. So role demands include, just in general, what expectations are there of you in the job that you have? What does the role of a supervisor, what does the role of a customer service representative require you to do, be it formally or informally? Role ambiguity is when you don't have enough information to know what your role is and what's expected of you. We often have high levels of role ambiguity when we start a new role within our organization or we enter into a new job. I'm sure many of us have experienced that first day panic where you say to yourself, I have no idea what I'm supposed to be doing, nor do I know what they want me to be doing. And when people don't give you enough information about what your job is or what you're supposed to be doing, that can actually lead to a lot of stress, right? To some people, I'm sure you're thinking, well, if I don't know what I have to do, then I don't have to do anything. But that's not going to keep you your job. So a lot of people, when that happens, they experience a high level of stress. There's also role conflict. This is when maybe you take on a new role in your organization, or rather an additional role in your organization, and you find that the roles are now in conflict with each other. Imagine that you are a manager who's also expected to make sales to clients. You work in a sales type industry. You're not only expected to manage people, but also make sales. You may find that those roles conflict with each other, right? You can't possibly be a good manager, listen to other people and help them out when they may be your competition for different clients, for getting commissions. So in that way, you may experience role conflict, where the roles that you occupy actually involve conflicting expectations for what you should be doing in the workplace. When there is role conflict, it can lead to stress as well. We can also experience interpersonal demands. Leadership is one way we can experience an interpersonal demand. When a person's leadership style does not match our desires or our needs for a leader, that can place us, that can that can result in a demand or a stressor. Interpersonal conflict can also lead to stress, especially when you have things like scarce resources, incompatible personalities, you don't feel that you're treated equally. All of these different things can lead to conflict in your workplace. And when there is conflict, that actually creates a demand on you. It creates a stressor that results in stress in the workplace. And it can lead to what we will talk about in a little bit, things like workplace violence, depression, job dissatisfaction, aggression, theft, sabotage. These are not good things. And through its impact on stress, it can lead to really detrimental employee outcomes. We also know that life outside of work can impact an employee's experience of demands in the workplace. Economic factors in particular can be stressful, and this can relate to some of the things here: life change or even life trauma, losing your job, having a family member lose their job, having your family member take on a different job that maybe pays less money. Economic factors, namely when people don't have economic prosperity, that can be very stressful. Research coming out of the Great Recession has shown that working under that time was very difficult, even for people who had jobs, who were lucky enough to find work during that time. It was still hard to deal with. And when you all look at the chapter on job loss, the section on job loss, it talks about this as well, about being a survivor of layoffs and how that can impact people. Like I said in the previous video, not something I cover in this lecture, but you are welcome to look at it. Work life and work family is something I'm going to cover in a lot more depth later. So just note that work life and work family issues can also lead to demands that people may experience, therefore, as stressful. Another approach to understanding how stress manifests in the workplace is conservation of resources, or COR. Conservation of resources theory argues that people seek to acquire and keep resources. These, for the record, are usually psychological resources. Of course, it can refer to things like tangible resources, money. But the idea here is that our resources, including those that are psychological, can help us deal with stress. That when we have resources like autonomy, for example, which I mentioned earlier, that can help me cope with my stress more than when I don't have autonomy. When people believe that they are losing those resources, or that they don't have the resources at all, it is a stressor, which leads to strains. In other words, if you believe that you don't have the resources, much like what we talked about with the demands resources model, when you feel like you don't have resources, you can perceive it to be stressful. And that can have a negative impact on employees. We can also see another perspective on stress in the workplace in the challenge versus hindrance stress distinction. Challenge stress is the distinction between these two things comes from the idea that some stressors may not actually be bad. Because up until now, the way I've been talking about stress and stressors assumes that all stressors are perceived negatively. These researchers noted that there are stressors in the workplace, demands in the workplace, that people may not actually respond to negatively. So for example, you could have challenge stress. These are stressors that are associated with the workload, a pressure to complete tasks, and time urgency. Some of this actually relates to what we've talked about with goal setting, right? When you have goals and expectations outlined for you and for your behavior, that is a demand. That may actually act as a stressor. But what this does is it's a good thing. It produces performance, right? You need some level of stress, some level of anxiety or fear over not getting things done to motivate you to get things done. So in that way, research has found maybe that challenge stress can actually have a positive impact on things like job satisfaction. On the other hand, though, we have hindrance stress. This is the kind of stress, or rather stressors, that limit your ability to get your job done. So things like red tape in your organization, politics, concerns about job security. So these kinds of things, which may even be related to some of the hygiene factors that we talked about in the motivation section, in the motivation module, these kinds of things actually can have a negative impact on employees. So we do find that while challenge stress leads to a positive impact on job satisfaction, we find that hindrance stress, on the other hand, leads to a negative impact on job satisfaction. So here this is acknowledging, and because some of you may be thinking, well, some stress is good, right? Yes, there may be some stressors in the workplace that can aid an employee and orient them and give them the little push they need to get things done. But then you also have hindrance stress, the things that actually make getting your job done difficult and therefore stressful. One little thing I want to note here before we talk about the outcomes of stress is this idea of multiple stressors. Now, does the presence of one stressor negate the presence of another? Do you, by virtue of introducing a new stressor, sort of replace another? No, not unless the person has resolved that previous stressor or dealt with it or managed it. In fact, adding more stressors to people actually just creates a cumulative impact on them. So you need to understand as a manager that when people are stressed, giving them more things to do, giving them more things to stress them will not help. Or thinking, well, if I give them something else to focus on, that will help them turn away from the thing that's actually stressing them. That probably won't work very well because people just see stressors and demands as being cumulative. In other words, they add on top of each other. They don't replace each other. They don't cancel each other out. They just keep piling up. So as I said, let's talk about the outcomes of stress. For the purposes of my lecture, and this aligns somewhat with what the textbook does, I've broken it down into behavioral responses, so the behaviors people engage in response to stress, psychological responses, so the psychological processes that we engage in response to stress, and then physiological responses, so what happens to our body when we experience stress. Okay. So in terms of behavioral responses to stress, I want to first sort of unite all the things I've been talking about thus far, because you may be saying, I still don't understand why emotions had to be part of this module. Well, when you experience emotions in the workplace, we find that stress accounts for, in part, the impact of your positive and negative emotions on outcomes in the workplace. So stress, or rather lack thereof, mediates the effect of positive affect on task performance and citizenship behaviors. In other words, your lowered experience of stress in the workplace, or your positive emotions lead to a lower experience of stress in the workplace, and that leads to more positive outcomes. We also find that stress accounts for, in part, the impact of negative emotions and negative affect on things like counterproductive work behaviors, or CWBs, and withdrawal. So we're finding that emotions lead to different levels of stress, and that this in turn impacts behaviors in the workplace, like task performance, like OCBs, CWBs, and withdrawal. So in terms of performance, what's really interesting and somewhat akin to what I've talked about with challenge stress is there are some researchers who argue that there's probably a curvilinear relationship between stress and performance. I should note this is theoretical, right? This is based on theory. This is the idea or the argument people are putting forth. I'm going to revisit why it's more complicated than this. But the theory behind this, because you may encounter it in your own workplace, is that there's an ideal level of stress, right? And we think about this in the classroom, in an athletics competition, in the workplace, right? You need, as I said earlier, a little bit of stress to give yourself the kick in the pants you need to get stuff done. But too much stress can be debilitating. It can be incapacitating. So in that way, there may be a curvilinear relationship between stress and performance, where you see here, there's this ideal level of stress. Too little, people won't get stuff done. Too much, and they're just incapacitated. But as I said, and I will emphasize 1,000 times, this is theoretical. The only place that we generally find that outside of a laboratory, so outside of an artificial and manipulated experience, so what we actually care about in IO psychology is that even moderate amounts of stress are bad. So going back here, it's not actually this outside of the lab. In the real world, we don't see this manifest. We find that even these levels of stress, they're actually not good for people. This is because stress is affected by numerous factors outside of the laboratory that we can't control. Things when you work in a more complex job, for example, the impact of stress is far greater than a low complexity job. So we find that it gets more complicated when we leave the confines of a very artificial and manipulated experiment in a laboratory in a psychology department. So I would just want to reiterate here, we find that even moderate levels of stress are not good for people. Um, so in that way, that curvilinear relationship may not actually emerge when we're looking in the workplace. So you may say to yourself, and you may even hear people say, well, I heard that some level of stress is good for people. We don't want complacency here. And if I were you, I would respond, well, we have to be very careful because even moderate levels of stress are not good for people. So you just have to be extremely, extremely careful about what level of stress you maybe want to induce to get people to do stuff, because you could cross over into the territory where it's going to be bad. You could get to the levels where it is bad, and we're even seeing in the research that even moderate levels of stress can just have a detrimental effect on employees. We also find that stress impacts information processing. Remember, we have limited resources and stress occupies those, and we experience stress when we don't have enough of them. So a lack of cognitive resources means that we can't process information well. So you therefore, when you experience stress, experience difficulty in focusing, and that can impact your memory, your reaction times, and other things that are really critical for work. We also find that when people are more stressed, they're more likely to engage in counterproductive work behaviors, and they're more likely to engage in withdrawal. So they're more likely to be absent and leave their work or quit. In terms of psychological outcomes, I'm going to focus on burnout and depression and a couple of others in the next slide. But burnout is something that gets a focus on in your book, and I think that's really important because burnout we can conceive as being the opposite of engagement, which is something we talked about in our job attitudes module. There are three aspects or three characteristics to burnout. These are emotional exhaustion, so that feeling of being drained; depersonalization, where you don't really feel connected to the people you're working with and interacting with, and you treat them like objects; and low personal accomplishment, so you feel really powerless to do anything. This also maps on a lot to some of the things we talked about in self-determination theory, as well as other theories of motivation. But here when you experience burnout, you experience a lack of engagement. So I just want to note here, lack of engagement here. So I'm going to actually make a little note so you can see, so I don't have any confusion here. Actually, lack of engagement. So I'm drawing a red line through it so you know, not engaged. When we have burnout, it leads to a lot of negative, or rather burnout in and of itself can lead to a lot of negative outcomes, as well as being a negative outcome of stress. We also find that depression is a pretty frequent psychological outcome of stress. This is often because the experience of stress often results from this feeling that you don't have enough to do what you need to do to get things done. Feelings of helplessness and perceptions of helplessness and being ineffectual are really critical to experiences of depression and hopelessness. And so in that way, stress can lead to this vicious cycle of depression, because depression also incapacitates people to do anything. The experience of hopelessness can lead you to actually feel like you are not able to get things done, and it's truly a vicious cycle. So stress can have some really detrimental outcomes on people in the workplace. There are also even more depression is a very serious outcome, and it's both clinical and non-clinical depression are very serious. When I say clinical, for the record, I'm talking about actually being diagnosed by a medical or psychological professional, so a psychiatrist, a psychologist with a degree, actually being diagnosed with depression, with anxiety. That's when I say clinical, that's what I mean. When I refer to it more generally, that can include things like depressive symptoms or depressive personality, or more the emotion of depression and anxiety, as opposed to the actual clinical DSM diagnosis of it. If this is something you're interested in, you should take an abnormal or clinical psychology class, because you can talk about that a little bit more. So Other outcomes of stress or rather stressful situations include things like PTSD. This is where you experience a trauma and the trauma leads to cascading effects of negative outcomes. We talk about this a lot in the military, but it can happen elsewhere. Trauma is not just limited to things that we would necessarily automatically say are traumatic. Of course, the experience of war is certainly traumatic, but having a violent customer come into your workplace can also be traumatic. Having a consistently psychologically abusive supervisor can be traumatic. So in that way, we can see employees develop PTSD from the work they do, with things as extreme as, yes, being in the military, to even some things that we wouldn't consider to be likely to produce things like PTSD. For example, customer service, particularly when you're dealing with really egregiously rude and unkind and abusive customers. We can also, from the stressors that we experience, develop secondary traumatic stress disorder, which is where you observe someone else experiencing a trauma. Once again, this can have a negative impact on people, and it shows that you don't even have to necessarily be the victim of a trauma to experience it as traumatic. And this is where I would be remiss not to say that, at this university, we do have programs where you can seek help. The Help a Zip has, I've already utilized it to refer students to since being here. So if ever you find yourself, especially now, especially during the pandemic, when the world is just turned upside down, if ever you feel like you're overwhelmed, don't be afraid to seek help. I know that that's something everybody says, and it's really easy to dismiss, but I mean it seriously. And if ever you need anybody to reach out to or shepherd you along the way, you can always reach out to me or any of your other professors. We are here to always help you. So just want to note that if ever you're feeling like you're overwhelmed and it's too stressful, there's no harm, no stigma, no shame in seeking the help you need to get through. The other reasons we would be concerned with these outcomes of stress on people is that the outcomes of stress are not just psychological. And in this age in which we still stigmatize mental health and mental health disorders, and people think that they're a joke and they aren't real, and would therefore dismiss all of the psychological outcomes I just talked about with stress, we therefore must also acknowledge, to convince these people that stress is worth caring about, that there are physiological impacts of stress as well. So there are immediate impacts of stress. It activates your sympathetic nervous system, and in so doing leads to the release of hormones, most notably cortisol. And when that happens, it results in long-term damage short-term damage to your body. I'll return to that in a second. It also increases your heart rate, so your blood gets pumping a lot faster when you're under stress. Now, long-term, you can develop heart disease and immune system issues from dealing with too much stress. The reason you experience heart disease when you've been under too much stress is, as I mentioned earlier, you release a lot of, in the short term, hormones, and your blood rate, or your heart rate increases. That increased heart rate actually creates damage to your body if you're also not used to it. So people who maybe are in good physical shape, this doesn't impact them as much because they've already primed their body and developed those muscles, and their cardiovascular system is already slowly has been well equipped to deal with high levels of heart rate and whatnot. For people who are out of shape, these things can cause damage to your cardiovascular system. It causes damage to your blood vessels, in other words. When that happens, your body responds to that by, deploying plaque and other things to repair, or rather in response to the repair process. That plaque builds up, and plaque buildup is effectively what can lead to heart disease and heart attacks. So that's how we see that people who experience a lot of stress do actually have higher rates of heart disease. It also has a negative impact on your immune system. So over time, we find that the chronic increase of things like cortisol and adrenaline, which is another hormone that your body releases in response to stress, can actually do a lot of damage to your body's ability to respond to threats in terms of disease. basically it's not good for your, it's not good for your body to keep living as if you're constantly under attack and under threat. Our bodies weren't meant to do that. Our bodies were only meant to really respond to attacks and threats when lions were actually trying to kill us or bears were trying to maul us, way back on the ancestral plane. Now we experience so many stressors, and it's killing us, through things like heart disease. So dealing with stress is a really important thing for organizations and for the employees to do for themselves. So let's talk about that, coping with stress. Now, what is coping? Coping refers to the efforts that help people manage or reduce their stress. There are some adaptive ways to deal with your stress, talking with others. This can be friends, this can be a therapist. This is why I say, don't be afraid to seek help. A therapist does not mean you're weak. It means you're strong enough to find someone who is going to help you survive. So better use of your downtime. So when you're at home, actually putting your work away, that's something that Americans in particular really struggle with because we're a nation of workaholics. And mindfulness training, mindfulness interventions, mindfulness apps. These are things that can help people cope with their stress. There's also problem-focused coping. This is where you try to focus on and deal with the source of your stress. So can you maybe minimize the stress? So if the source of your stress is another coworker, can you try to get into another unit? Can you try to understand that person and the way they're causing your stress? I know I have worked with people who just the mere sight of them made my heart race, and not in a good way, and I don't want to talk to this person way. I don't even want to see them, avoided their side of the building at all costs kind of way. You could either try to do those things like, get transferred to another unit, or try to understand why the person maybe does that to you and how you can maybe try to understand them differently so they don't. And then you can also do emotion focus. So this is where you actually try to, maybe you recognize I'm never going to not work with that person. So I just need to focus on the emotions I experience and how can I adaptively cope with them and manage them. So understanding that, okay, I know I have a meeting with this person. So right afterwards, I'm going to have a 10-minute yoga session or listen to something that's going to help me calm down or do breathing exercises. There are also maladaptive ways to cope with stress. This includes things like alcohol use, drug abuse, etc. Though many people resort to using things like recreational drugs, marijuana, and alcohol to cope with work. And in fact, it's almost so normative that people don't think that it's weird when someone says after a long week that they're going to go home and drink till they pass out. That's actually a maladaptive way of coping with stress. We usually don't want to cope with stress in ways that can lead to cirrhosis of the liver. So in that way, we want to avoid that as ourselves and for our employees, and we want to equip them with how to deal with stress better. And we will talk about that, I think, in a little bit when we talk about what organizations can do to help their employees a little bit better. So let's go ahead and talk about some stress adjacent topics. I set these aside because I wasn't quite sure where they would fit in the narrative that I've built thus far. Some of these are things that, like I said, organizations can do to help employees. Other things are experiences in organizations that lead to stress but didn't really fit into our conversation earlier. So one of those things is work family. Work family, I did mention, is one of the demands that can impact people and lead to stress if they don't have resources to deal with them. Work family, we often talk about in terms of work family conflict. That's usually what IO psychologists are focused on. This is where work and family don't coexist well. Your work either interferes with your family, so your work makes you unable to be present and actively engage with your family in the way you want to be, or your family interferes with your work. This is especially both of these are especially salient during COVID, actually, especially with people working from home and children not being in school and having to do distance learning, which it's just so hard. So the other side of that, though, is work-family enrichment. This doesn't get discussed as much, but it is sort of the other side to work-family conflict, which is when actually your work and your family coexist well and enrich each other. So your experiences at home enable you to work better, and your experiences at work enable you to be more present and a better member of your family, whatever that may be, parent, spouse, partner, caregiver to an adult member of your family, etc. So work-family conflict is really interesting because there are individual differences and there are cultural differences. There are so many differences that impact the extent to which we experience work-family conflict and the extent to which, therefore, it impacts us. We know that there are gender differences. We know that women experience work-family conflict more and it impacts them more. This is just what the research has shown. We can, engage in gender stereotyping if we really want to, that, women do tend to be more communal and more socially oriented and more oriented toward family. We could talk about whether that's genetic or socialized, but that's a conversation for probably an entire semester worth of sociological studies. But the point is, research shows that women experience work-family conflict more than men, and it also impacts them more than men. We do find, though, that as men age, they start to care more about work-family conflict, or rather experience it more. And this is the argument, at least made in your textbook, is that this is because priorities change over time for men. For women, I guess the implicit argument is that our priority is always family. Once again, this is a question of whether this is genetic or socialized. And we could talk about that for a whole semester. Boundary control is also a critical thing that influences the extent to which people respond to work-family conflict as a negative thing or as a difficult thing. So basically, do you feel that you have control over the interference of family and work and vice versa? So if you feel like you are able to control the amount of interference that work has on your family and your family has on your work, and you are okay with what it is, then it won't impact you, right? If you accept and understand that your family life is going to impact your work, but you're okay with it and you're okay with that boundary blurring, and you feel like you have control and the ability to change it if you want to, then work-family conflict may not impact you as much as, say, someone else who doesn't feel like they have that control. Remember, a common theme throughout this class is that feelings of control and autonomy are pretty important for workers. Boundaries, though, are particularly blurry, especially in American culture and especially now under COVID, right? That we can't make those clear demarcations anymore between what is work and what is home if you're working from home and your children are at home all of the time. So boundary control is a very interesting thing to consider under a time of COVID, and whether people can experience that level of control that they need, especially also when so much of what is going on right now has very little to do with a worker's autonomy and everything to do with what local health officials tell you or your company tells you you're doing in order to mitigate the impacts of COVID. Another thing that isn't listed here, and I don't think we talk about, but I just want to note, is that, like I said, certain cultures also don't experience work-family conflict as much. That's because, or at least people, I shouldn't say certain cultures, people from certain cultures may not experience work-family conflict as much. The thinking behind this is that in certain cultures, the idea of family and work being separate things and work, say, not functioning to benefit one's family, or I should say, so in certain cultures, the idea of work and family being separate things or not at least interrelated things doesn't exist as much as it does in American culture. So here we see these things as being pretty separate, pretty distinct, and pretty isolated domains. In other cultures, people see work as what you do to support your family. So whatever you do at work is not seen as antithetical or taking away from what you do to benefit your family, in a nutshell. So in that way, they also don't experience work conflict as much, and it doesn't impact them as much either. So what can organizations do to minimize work-family conflict and therefore stress for employees? Well, one way that organizations can do this is they can engage in, or rather train their supervisors to engage in family supportive supervisor behaviors. So this is when your supervisor actually values family and work balance, so doesn't pay lip service to it, but actually cares about ensuring that you have found good work-life balance. I can't tell you how refreshing it is to have a supervisor who actually who actually understands that you would want to spend time with family, who understands that you have a life outside of work, that you should be able to train for a marathon and have the hours to train for a marathon on your off time, for example. I've worked in organizations where the idea that I was spending my off hours training for marathons or training for races was looked at with disdain and wondering, well, why aren't you spending your off hours working for work that you're not getting paid for? So in that way, having supervisors who are supportive, it can really positively impact your employees. Similar programs and policies related to things like family support supervisor behaviors lead to things like job engagement and satisfaction. People are more likely to stay in your organization if they feel like they are supported in identifying the balance they want to between work and home life. For the record, work-life balance does not mean that someone's able to prioritize all of their outside stuff and never get their work done. No, this is balance. They are doing their work, but they also aren't doing their work in a way that is compromising the things that they find valuable outside of work, that you aren't placing demands upon them that are excessive and beyond what we would expect them to do. Those employees also therefore have better mental health and they have less spillover into their family life, and that can be a virtuous cycle. So I talked about a vicious cycle earlier with depression and stress. Virtuous cycles can be where it spills positively over into family. And if your family life's doing better, that comes back into work. You come in happy to work, as opposed to people who are exhausted at home and they come into work and they're exhausted there. You're going to have employees who burn out and leave. So it's always a good thing to support your employees to find work-life balance that, yes, satisfies their need to do their job, but also satisfies their need to be fulfilled outside of work. What else can organizations do? Well, they can also provide family leave. There's the Family Medical Leave Act, which provides job-protected unpaid leave for 12 weeks. I emphasize unpaid because I feel like this is something a lot of Americans don't understand, is that FMLA, that's what it's usually called, is FMLA. FMLA is unpaid leave. What that means is that if you take FMLA, say you have a child or your spouse gives birth to a child, or you have a spouse or a partner or a child who's very sick and you need to take time off to care for them, you can get job protected unpaid leave for up to 12 weeks. You usually also have to work for your organization for a year before you will get unpaid leave. What this means is that you do not get paid a salary. The government does not mandate that you get paid when you take this leave. This makes the United States, for the record, extremely rare and an outlier compared to all other industrialized nations that presume to have the same values that the United States does in terms of valuing things like family. So what this means is that your job is protected, but you don't get paid. And we'll talk about this in a little bit. But FMLA is kind of a double-edged sword. You take it, but you don't get paid any money. Some companies, though, interestingly enough, if you take FMLA, they force you to also exhaust your sick leave. So in that way, you get paid. And in that way, they can make it seem like, oh, you get paid parental leave, but it's not paid parental leave. You're just exhausting your sick days. So when you come back from FMLA, you don't have any more sick time. So if you want to take, say, 2 weeks of FMLA, let's say your wife just had a child and you want to take a couple of weeks off to be with the baby and your wife during this important time, you will have to use 10 days of your sick leave. And so let's say your wife has a baby at the beginning of the year, then you've exhausted all of your sick days or a lot of your sick days at the beginning of the year. And you're just hoping that for, I guess, the rest of the year, all 11 months, you're not going to get sick or that you're not going to need that time. It's a huge problem. And it's a huge misconception about what FMLA is. Because in organizations, what's really interesting is organizations like to tout that they provide FMLA. They're legally required to do it. They have to do it by law. What makes an organization unique and therefore caring about its employees is, does it actually offer true paid parental leave, where they aren't forcing you to take sick leave in order to get paid. They're actually paying you during the time off, like they would if you took or just like you would if you were working, right? And I should note, and we'll talk about that again, I said in a little second, Job protected means that you can come back to your job or an equivalent job if you take FMLA. So I've taken FMLA twice in my life to have my 2 children. What that meant is that I took time off to have my children, to care for them, and that when I came back after taking FMLA, that my job as an assistant professor would still be there, and it was. So that means that, or if you work as a manager, you're going to take FMLA, you come back, your managerial position is there, or an equivalent managerial position is available to you. Another related thing is parental leave. Parental leave is more related to, and it just really doesn't exist in the United States too much, but being able to take leave to care for your children in the first 5 years of life, which are very important for their development. Once again, doesn't really exist in the United States. A profound irony given how much people purport to care about family and making sure that the family unit is sacred and safe. What's really interesting though is that even companies that do provide family leave and paid parental leave, so they're actually paying you for the time that you take off. You're not forced to take your sick leave. You're basically getting paid not to work, in the sense that you're taking care of your child, which is a very important and very valuable thing, or you're caring for a sick family member, also a very valuable and very important thing. What we find is that first, or I should say, when people, so let's step back a bit. Let's pretend that we're in one of those organizations that just does what the government allows you to do, or rather forces you to do, which is provide unpaid protected leave. So your job will be there, but you're not getting paid. Or you are being forced to exhaust your sick leave, which most people probably don't have more than, a couple of weeks built up of that. You find that most people will cut their leave short, that they will stop their leaves early so they can come back to their work, because it also can impact your health benefits depending on the company. You may have to pay your full insurance premiums on your own if you are taking unpaid leave. So it becomes actually more expensive in the cases of some companies for you to take unpaid leave, in terms of the benefits that your company would have otherwise been paying into. So, and because of that, you have people who return very quickly 2 weeks after having children, which if you've ever had any children, or if you've ever had any major surgery, imagine being asked to return to a full-time, full job where you're expected to be on your feet all the time 2 weeks after you've had major surgery. It's insane. And I once worked for an organization that prided itself on the fact that they had women who returned 1 to 2 weeks after having children, and how great it was that they returned so quickly, which is, it's truly an insanity. But the flip side, so we find that when people have unpaid job protected leave, they return early because they can't afford that. They can't afford weeks off without pay. Even though their job is protected, unless they have a spouse or a significant other, they have a decent amount of savings. To go 12 weeks, that's, 3 months without pay. How many of us could afford that? How many of us could afford three months without pay? Though we will have our jobs, you would have to have a significant other or a decent amount of savings to survive that time. So that's why people leave. And that can actually create a lot of stress when you only provide FMLA and you don't provide paid leave. You're forcing your employees to deal with, going back to Maslow's hierarchy of needs, do I put a roof on my head? Do I actually care for this child who has just been born? For the record, most daycares also, they don't take kids some daycares don't take kids before 3 months of age because they're so young and fragile. So some of you might be saying, well, then just put the kid in daycare, right? Just put the kid in daycare, that'll be fine. A lot of daycares don't take kids that young. So it forces employees into these really difficult situations and actually may create more stress. Now, if you have paid leave, though, that may seem like, well, that's what we do. Then we provide paid leave, and people will be able to take the time that they need and not feel forced back. That's wonderful and great. And that's what a lot of Silicon Valley companies have done. Once again, making the distinction between paid and unpaid leave. Unpaid leave, your company is not paying you. Some companies try to argue they offer paid leave because they force you to take your sick time and then you're left with no sick time after you exhaust it to take FMLA. That's not paid leave. Paid leave is where they don't force you to take your sick time, don't force you to take vacation. You get paid for the time you take off to take FMLA, to take care of your children, to take care of sick relatives, etc. So here you can see a little infographic about some of the Silicon Valley companies that offer paid parental leave or paid leave. Some companies offer up to 4 months, above and beyond even what the FMLA, the federal government, requires you to do. What some reports out of Silicon Valley, though, have shown is that, unfortunately, the cultures in these organizations don't actually really allow for people to take that. So very few people actually take these organizations up on it. So they get all the kudos for offering things like 4 months of paid leave, but very few employees take it. The reason for this is that while they would love to be at home with their children and taking that time off for that very important parental bonding, these people effectively lose out on a lot of the projects that they would be working on. They get kicked out of projects if they're going to have kids. They lose out on a lot of the productivity because these organizations are often project-based. So if you have 4 months where you didn't do any projects, you know what? There are employees who have in their resume 4 months where they were present and doing projects, and they therefore have a more robust resume. So this is where sometimes that mommy tax, which we talked about with the gender pay gap, comes up, because women usually are the ones who take time off to care for their children. And also, if you have particularly hard pregnancies or deliveries, you can't go back to work. You've had major surgery, much like if you had your ACL repaired or if you had your appendix removed, you wouldn't go back to work immediately. If you have a C-section, you can't go back to work immediately. You can't really, get out of bed, or your movements are limited, or you just feel ill. So in that way, you find, though, that women end up paying this mommy tax because we end up taking the time off to care for children. But you do find that even fathers and mothers who work in these organizations don't take them up on these paid leave policies because it impacts their career growth and it impacts their career development. And like I said, these companies get all the kudos for offering these paid leave policies, but very few people take them up on it. So that's an interesting thing for us to think about as we go forward. How can we encourage people to have work-life balance when they particularly need it, or rather when they especially need it when they've given birth to a child or adopted a child, in a way that won't impact their career, in a way where they won't be saying, well, I still get paid leave, which is great and wonderful, but now I have to worry about whether I'm going to lose out on career goals and career opportunities because I took 4 months away from work when my colleagues who didn't have kids were working and getting on projects. Sorry, that's a very long discussion, but I think that there are a lot of important misconceptions to what FMLA does, and even to what some of the solutions to these issues with the federally mandated FMLA try to deal with, or sorry, I should say, there are misconceptions about what the government requires people to do, the federal government. There's misconceptions about the benefits then of what some of these very benevolent companies do, namely that even though they provide truly paid leave, some employees don't take them up on it, and it can still be really hard for employees to decide how much time they take off. It's something I could talk forever on. It's something a student of mine and I are researching here right now is FMLA and people taking it. And I think that's it on FMLA. So another thing that organizations can do is childcare benefits. This is where organizations have daycare. They also have subsidized childcare, so they will pay you a certain amount of money to send. Not necessarily pay you to send your kid to daycare, but they give you almost a stipend to spend on daycare. They also, I should say that research has shown, at least here, that people who have to fill a parental role, so people who are playing a large parental role, have lower psychological well-being. It decreases life and marital satisfaction and increases work-family conflict. What I would argue here is that is because organizations and the culture of the United States don't actually really support parents who want to pursue both being a parent as well as being fulfilled through their work. So it's not necessarily, in my opinion, that it's because you're filling a parental role that you are less satisfied. It's because our culture really doesn't encourage people to be both parents and working, no matter how much the praise that is, extolled upon people like Sheryl Sandberg would have you think otherwise. I should note that was one thing. That was what I wanted to say about FMLA. There are some states like California that actually do require paid leave for people in those states, or they also have more robust short-term disability. So everyone in California goes into short-term disability, which also you can take when you need to take FMLA. So there's just a lot more protections in a state like California where people are allowed to take more leave, and the government there is encouraging it. Compare that to places like Texas, where that is not the case, and you just get what the federal government tells you can get. So anyway, another thing that organizations can do is elder care benefits. There are about 43.5 million adults who are unpaid caregivers, and that number is bound to increase as the boomer generation retires and becomes older and is in need of care. So one of the ways that organizations can help people is they provide dependent care accounts. This can also be used for your children. So some organizations allow you just, to have money in order to pay for, say, daycare or dependent care, so an at-home aide, etc. And these things really help with that work-life family balance that people need in order to reduce the amount of stress that they experience and the amount of work-family conflict that they experience. So what else can organizations do? So another thing that we know is, especially when dealing with work-family issues, is that we sometimes have dual earner couples. About 20% of children under 18 have had a traditional family setup, and that's meant to highlight how low that is. And here, a traditional family setup is where the father works and the mother stays at home and does not have any job or source of income herself. Or sorry, I should say formalized job, because being a stay-at-home mom is an unpaid job. And it's an insane amount of hours and work that usually women get no thanks and no pay for. So, but 80% of people, though, this assumes that then 80% of children are having two parents working. What that then means is that when you're dealing with dual income households, what that means is that the parents who are working also have another job that they have to do, and that's caring for the child and the children. Compare that to, say, your stereotypical 1950s setup where you had a dad who worked and a mom who was at home and took care of the house and everything. The dad would come home and not help with the house because the mom was 100% in charge of helping with the house. Now that both people are working and no parent is in charge, or no person is in charge of dealing with the household, you now basically have two people doing three, or in my opinion, four jobs, right? Because usually one parent manages the children, the other parent, if you have children in the household, one parent manages the children, the other parent is doing the chores, cleaning the house, taking care of the house. So in that way, you have two people now actually occupying four jobs, as opposed to these more traditional setups that maybe you basically compartmentalize. One person went out and made the money, the other person stayed home and was a home, was a homemaker, if you will. And so in that way, it can actually be really stressful for dual income earners, because you don't have that compartmentalization. You don't actually have a lot of hours. When you get home at 5 o'clock, you have maybe, if you want to get a good night's sleep, 5 hours to get stuff done. And if you have children, good luck doing that. And so it's a lot of stress to actually be in a dual income earner household. Yes, you have more money, and usually people use that to get house cleaning services or a cook or meal delivery services. But for people who are dual income earners and are on the lower income earning spectrum, that's not an option. And so this can really lead to a lot of stress for employees. In your book, it talked about something related to rubber and glass balls, that some balls are rubber and some balls are glass. And this is really, the point was that family is a glass ball that you can't drop. But what I would argue is that this illustrates that some people don't actually consider family to be a glass ball, and that it's really unfortunate that some things are seen as being glass balls when we should be treating them as rubber balls, like work. Most people probably say work is my glass ball. If I drop it and it breaks, then I drop it and it breaks and I can't get it back. Whereas some people would say that should be how we approach family instead. And so I think that that's also important to consider, that some people don't perceive it that way. And maybe that's something that our culture needs to change, what we consider to be a rubber ball and what we consider to be a glass ball. Now let's talk about workplace violence. So we've talked about some of the things that can impact employees in terms of their work-family conflict and how it can be beneficial for organizations to intervene. Workplace violence is really important to look into because it's actually a really prevalent thing, and it's obviously a huge concern. Because homicide is one of the leading causes of death among employees. You think, oh, it's workplace accidents, and yes, that's important, but homicide, murder, is one of the major causes of deaths for employees, which is bananas. Many of this is, of course, due to firearms and shootings in the workplace. Now, we are also talking about, when we talk about workplace violence, millions of non-fatal violent crimes that go on in the workplace. And some research would suggest that 25% of non-fatal violent crimes go unreported. So this is probably an underestimate of what goes on in the workplace and how much violence we experience at work. Now, which jobs is it more likely to experience workplace violence in? When you have contact with the public, so you're interacting with other people outside of your organization, when there's an exchange of money, obviously, because people will try to steal that. And exchanging money can be a high stress situation. When you're delivering any goods, when you work in a mobile workplace, when you have isolated work, so there's one of you or very few of you working, that can actually lead to more workplace violence. For those of you who have been in any form of bartending, this should come as no surprise that serving alcohol, if your job involves the service of alcohol, that's more likely to lead to an experience of violence. If you care for others, that's far more likely to lead to violence, or disciplining others. Any job that involves use of weapons, firearms, knives, etc., that can lead to workplace violence. And if you have any decision that can impact others, so even if you're like an insurance claims adjuster, you could experience violence in your workplace because you're making a decision that really impacts other people. So we know where workplace violence is more likely to happen. Now, who is more likely to commit workplace violence? Well, in general, I want to note here, though it's not on the slide, people who are stressed are more likely to commit workplace violence. That's why we're talking about it here. But we also know, based on lots of data, that there are just certain types of people who are more likely to commit workplace violence. It's usually white males between the ages of 30 and 60 years old. They are socially isolated individuals, and they experience a triggering event, usually being fired, being rejected, being passed up for a promotion, that leads to their violence. They also have aggressive tendencies, bizarre and unusual behaviors, and there are other behavioral signs like a history of violent behavior, having a severe psychological disorder, having evidence of depression, having a chemical dependence on something like alcohol or drugs, having an obsession with another person, and experiencing chronic frustration and having a preoccupation with weapons. The point here is not that if you know anybody like this, that you should automatically assume they're going to engage in workplace violence, because that's problematic too. But it's also good to be aware that these kinds of things can be concerning and that you maybe need to intervene earlier rather than later. Not necessarily fire these people, but try to get them into a program, try to get them to maybe find healthier ways to deal with things that don't involve aggression and weapons. It's just more to be aware of what you need to be on the lookout for. Teachers are trained on this. Lots of workers, HR professionals were trained on this as well. So what else can organizations do to reduce stress? I think we talked about flex work arrangements in our motivation section, but just to remind you, this is where workers can basically determine the hours that they work. Once again, not necessarily that people are choosing not to do their job, but that they have autonomy in choosing the hours of the day that they work, or if they want to do a compressed schedule, those sorts of things. Having conveniences in a workplace, so having free food, like Google does for their employees, for example, having transportation to work like Google does, which of course is not without its downsides, because the Google buses are often attacked by people who are unhappy with what Silicon Valley has done to Northern California. Then you also have health promotions, so having maybe an on-site gym or gym subsidies to help your employees. There's also education assistance, so some of you may work for companies, I believe Starbucks has education assistance program, so they help subsidize your college tuition or pay for a certain amount of credits. I think Amazon does as well. I could be wrong on that. Housing assistance, so particularly in places like California, where it's very expensive to live, you may have housing assistance or housing adjustments. I know for family members of mine who live in California, they recently were saying, if they work somewhere else, they work for the government, but if they work somewhere else, either even in the state or in the country, that they would get paid less. And this is usually because their organizations are accounting for how much it costs to live in California in places like San Francisco. So you can find housing assistance. This also happens in universities. I was once interviewing for a university that offered they offered basically zero interest loans. So you could, if you bought a house within 5 miles of campus, they also had extremely subsidized, very nice faculty housing. So super small liberal arts schools have often bought up properties around them, and then they allow faculty to live in them for very low rent. I have a friend who's doing that right now at Lake Forest College, lives in this beautiful, nearly 100-year-old home, and is paying way less in rent than anybody in that neighborhood does. So this is some of the things that organizations do, especially in places like Chicago, LA, San Francisco, New York, where it's very expensive to live. And then there's group deals. I'm not sure if Akron does this. My previous institution did this. A lot of organizations do this, where if you share your employee ID, you can get discounts at local organizations, restaurants, theme parks, etc. The point of these policies is not just because they look good and they attract good talent, but it reduces your employee stress. In showing that you value work-family balance is really critical as an organization and can reduce stress. Reducing stress leads to way better employee outcomes. So I know some people, especially older generations, think that we really shouldn't care about employees' emotional well-being and their stress, but it actually is really important to care about your employees' work-family balance, to care about caring for your employees, because yes, it does lead to better job performance, and we should care about that, and it is good for your financial bottom line, but it's also good to care for your employees, because you should want employees who are happy and satisfied with the work that they're doing. So that's it. Sorry for the little tangent on FMLA, but it's an area that I study, and it's something that I really like to dispel the myths and the notions on, and to point out that even companies that look like they're doing a good job at providing FMLA and providing paid leave, it's not without its downsides. So that's it. And I'll see you all in class on Thursday.